Today, we are going to answer that. We are going to go through the claimed benefits one by one, put them against the research, tell you what holds up, what is exaggerated, and what is flat out wrong. And we will tell you who should never get in a cold plunge, no matter what the influencers are saying. Stay with us, because one of the most popular benefits of cold plunging is probably doing you less good than you think. And if you are using it for that reason, you need to know. Let us start with the one that gets almost everyone through the door, the energy and mood boost. You step into cold water. Your body panics. Your heart rate spikes. Norepinephrine floods your system. And within seconds, you feel more alive than you have all week. That part is completely real. Studies have shown that cold water immersion can increase norepinephrine levels by 200 to 300%. That is a massive neurochemical shift. It sharpens focus, elevates mood, and creates that electric feeling that cold plunge enthusiasts describe as addictive. Dopamine also rises significantly during and after cold exposure. Research published in peer-reviewed journals has found that cold immersion produces a sustained increase in dopamine that can last for hours, not just minutes. This is not a spike and crash like caffeine. It is a long, slow release that contributes to motivation, drive, and a sense of well-being. So on the mood and mental energy front, the science is solid. This is one of the real benefits. The cold plunge community is not exaggerating here. What they are sometimes getting wrong is the mechanism, but the outcome checks out. Now here is where we need to pump the brakes. Muscle recovery. This is probably the most cited reason athletes use cold plunging, and it is also the one where the research is most complicated. For decades, the protocol was simple. Hard training session, jump in ice bath, reduce inflammation, recover faster. And in the short term, that logic has some merit. Cold water immersion does reduce acute inflammation and can decrease perceived soreness. If you have a game tomorrow and you need to feel better today, a cold plunge can help with that. But here is what the wellness influencer selling you a backyard tub is not telling you. That same inflammation you are suppressing? Your body needs it. Inflammation is not just a side effect of training. It is a signal. It is your body saying this tissue was stressed and we need to adapt. Blunt that signal too aggressively, and you blunt the adaptation. Research published in the Journal of Physiology found that cold water immersion after resistance training actually attenuated long-term muscle growth and strength gains compared to active recovery. Another study found that cold exposure after endurance training interfered with mitochondrial development, one of the primary ways your aerobic system gets stronger. So if you are a competitive athlete using cold plunges daily after strength or endurance sessions with the goal of getting bigger, stronger, and faster, you may be working against yourself. The cold feels like recovery. It might actually be costing you gains. The nuanced answer is this. Cold plunging after competition makes sense. Cold plunging every day after training for long-term performance goals probably does not. Timing matters enormously. Let us talk about fat loss, because this one has generated an enormous amount of hype, particularly around the concept of brown fat activation. Here is the biology. Your body has two types of fat. White fat stores energy. Brown fat burns energy to generate heat. Cold exposure activates brown fat. Brown fat burns calories. Therefore, cold plunging helps you lose weight. That is the chain of logic, and it sounds airtight. The reality is more complicated. Yes, cold exposure does activate brown adipose tissue, and yes, brown fat does burn calories. The problem is the quantity. The calories burned through brown fat activation during a cold plunge are relatively modest. We are talking dozens of calories, not hundreds. And while repeated cold exposure over months may modestly increase your brown fat stores, the effect on body composition, when isolated from diet and other exercise, is not dramatic enough to drive meaningful fat loss on its own. Cold plunging is not a weight loss strategy. It is a complement to a healthy lifestyle, not a replacement for one. Anyone telling you otherwise is selling something. Now let us get to the immune system claims, because this is where things get genuinely interesting. The Wim Hof phenomenon brought cold exposure and breathwork into mainstream consciousness, with claims of being able to voluntarily influence the immune system. In 2014, a study published in PNAS tested subjects trained in the Wim Hof method against a control group, both injected with bacterial endotoxins. The trained group showed significantly lower levels of inflammatory markers and reported fewer symptoms. That was a remarkable result. More recent research has looked at cold water swimming and its association with immune markers. Some studies show increases in white blood cell counts and natural killer cell activity with regular cold exposure. There is also intriguing epidemiological data suggesting cold water swimmers get fewer colds and upper respiratory infections. But here is the important caveat. Most of this research involves chronic, regular cold exposure over weeks and months, combined in many cases with breathwork and mindset training. The effect of a few cold plunges on your immune system is probably negligible. This is a long-game benefit, not a quick fix. If you are consistent, the immune data is encouraging. If you are doing it sporadically when you feel like it, do not expect your immune system to notice. Let us talk about mental health, because this is the area that might actually be the most legitimate and the least talked about. Beyond the norepinephrine and dopamine effects we already covered, cold plunging has a documented relationship with mental resilience. Getting into cold water is uncomfortable. Your brain immediately generates a very powerful message. Do not do this. Every time you override that message and get in anyway, you are practicing something deeply important. You are training the neural pathway that says you can act despite discomfort. You can do the hard thing. This has real carryover to anxiety management, to stress tolerance, to the capacity to function under pressure. There is preliminary research suggesting cold exposure may have antidepressant effects, and case studies of individuals using cold water swimming as part of managing depression show promising outcomes. A case report published in BMJ Case Reports documented complete remission of depression symptoms in a young woman following a course of cold water swimming. This does not mean cold plunging replaces therapy or medication, but as an adjunct practice that builds psychological grit and influences neurochemistry in a meaningful way, the case is real. Now let us address something that almost no one in the cold plunge world talks about openly: who should not be doing this. Cold water immersion causes an immediate and significant cardiovascular response. Heart rate accelerates. Blood vessels constrict. Blood pressure spikes sharply. For healthy individuals, the body manages this without incident. For others, it is a genuine risk. People with cardiovascular disease, hypertension, arrhythmias, or a history of heart attack should not cold plunge without explicit clearance from a cardiologist. The cold shock response has been associated with sudden cardiac events in vulnerable individuals. People with Raynaud's disease, where cold triggers severe vascular spasms in the extremities, should approach cold immersion with extreme caution. Pregnant women should avoid cold plunging. People on certain medications that affect heart rate, blood pressure, or circulation need to consult their physician first. The wellness space tends to present cold plunging as universally beneficial and essentially risk-free. It is not. For most healthy adults, it is safe, but the subset for whom it carries real risk is large enough that this conversation needs to happen before you buy the tub. Let us also be honest about what we do not know yet. Many use different protocols, temperatures, and durations, making direct comparisons difficult. Most do not control well for the other lifestyle factors that typically accompany people who cold plunge, including better sleep habits, exercise, and nutrition. We are drawing conclusions from a body of evidence that is promising but not yet definitive on many claims. The honest position is that cold plunging has real documented benefits in the areas of mood, mental resilience, and acute inflammation management. It has promising but incomplete evidence around immune function. And it has overhyped or misrepresented benefits around muscle hypertrophy and fat loss. That is not a reason to dismiss it. It is a reason to use it intelligently. So what does intelligent cold plunging actually look like? Temperature between 10 and 15 degrees Celsius, roughly 50 to 59 degrees Fahrenheit. Duration between 2 and 5 minutes per session. Frequency of 3 to 5 times per week appears to capture most of the neurochemical benefits without interfering excessively with training adaptations. If you are a strength or hypertrophy athlete, consider reserving cold plunges for rest days or competition recovery windows rather than immediately post-training. Morning sessions appear to produce stronger alertness and mood effects due to interaction with cortisol rhythms. Always ease in, especially if you are new. Cold shock response is most dangerous in the first 30 seconds of immersion. And breathe. Slow, controlled breathing from the moment you enter the water activates the parasympathetic nervous system, counteracts the panic response, and makes the entire experience dramatically more manageable. Here is the bottom line. Cold plunging is not a miracle. It is also not a scam. It occupies that middle territory that good health tools usually occupy, which is genuinely useful for specific purposes, overmarketed for others, and most valuable when understood clearly and applied consistently. The people getting the most out of cold plunging are not the ones chasing every claimed benefit. They are the ones using it deliberately, tracking how it affects their mood, their energy, their focus, and their consistency, and building it into a broader lifestyle that supports their health. If this video gave you a clearer picture of what cold plunging can and cannot do, share it with someone who is on the fence about starting. And if you want to go deeper on evidence-based health practices that actually move the needle, subscribe and turn on notifications. We cover the real science behind what works, without the hype, every single week.